All right, good morning, committee. Let's go ahead and get started because we have our final 10 budgets that we need to have reported out. Again, I want to commend everybody for the work that we did last night because we went through 14 budgets yesterday. So the first item on the agenda, are there any bill introductions? Representative Tarwater.
Thank you, Mr. Chairman. I have a bill 25-1055 having to do with the Attorney General establishing a safe and secure firearm detection program.
All right, committee, you've heard the bill introduction. Is there a second? Second by Representative Sutton. All those in favor of the bill introduction say aye. Aye. Opposed? All right, bill is introduced. Are there any further bill introductions this morning? All right, seeing none, we'll go ahead and turn it over to Chairman Buehler with the Social Services Budget Committee, and I believe you'll be starting with the Department of Children and Families. Chairman Buehler.
Yep. Thank you, Mr. Chair. And before I get started, this little place setting, I have 3 agencies or budgets today. I'm starting the easiest first. We'll work up to the other 2. But before I forget, I do want to thank the team that as we get into this, you'll understand. Francie Hernandez, my committee assistant, who's not here, but the revisers and the research team of Molly Pratt, Megan, Dayton, I don't want to forget Jill, and Amanda have been tremendous. A tremendous amount of work in what you're going to hear in these next 3 budgets, and I don't want to omit what they did to get us here. So that's my little preamble for the morning. Okay. So at Department of Children and Families, the agency overview, cabinet-level agency headed by the secretary appointed by the governor. They have 8 main budgetary programs, and I'm not going to delve into that too deeply. But if you look at FY 2025 and you look at the spending at the agency, LBC, and House level, you'll see a pretty good story from, I guess, consistency or use of funds. The agency's budget or the request was $1.1 billion. The LBC recommendation is about $26 million less than that. And then our House subcommittee came in not quite at the $26 million, but about $21 million below in terms of total spending. So the agency's revised request, as I mentioned, includes 1.1 in all funds. I think you can read through the areas where funding has lapsed. One of the big things was, and we'll talk about this, the summer EBT benefits program. So that being the starting point for the agency, the LBC came in and deleted the remaining $23.8 million SGF reappropriations for FY25. They added back $3 million in SGF and $400,000 in TANF cash assistance. I think that next paragraph, though, is helpful in terms of understanding where big buckets of money are coming from. The FY25 revised estimate for the foster care program is $342.7 million. Which includes $244 million of SGF. This decrease or increase is due to a decrease in projected SGF savings in the relative licensing policy. Can be attributed somewhat to higher than anticipated final payment for previous case management provider contracts, higher placement costs due to hospital stays not covered by Medicaid, and increased SGF costs associated with the standby bed network program. That being said, in our House Budget Committee, we concurred with the LBC's recommendation for FY25 with just a couple of adjustments. We added back $3.7 million, including $1 million SGF to administer the summer EBT program, and I have information on that if anybody's so inclined. It's a 50-50 match to administer the program. The benefits are 100% federal dollars. I'll go into more detail if there are questions on what the summer EBT program is, but that was one of our adds. We also added back language to lapse any unspent monies from administering that summer EBT program in FY25. And the third one, finally, for FY25 was to add roughly $1 million to fully adopt the fall human service caseload estimates for FY25. This amount was inadvertently lapsed when the Special Committee on Legislative Budget recommended to adopt the fall human caseload estimates. And with that, I would stand for questions on FY25.
All right, thank you, Chairman Buehler. So I want to go back to item number 1.
Okay.
Because we were looking at the governor's recommendations. I believe it's item number 8 on her recommendations, which is adding $1.8 million in 2026, including $925,000 SGF. But on item number 1 for 2025, It's adding 3.7 million, including 1.8 million SGF. So why is the number higher in 25 than what the governor recommended? I don't know what your committee recommended in 26. We'll get to that when we get to that, but that year. But why is that starkly higher than what she is recommended in 2026?
Thank you, Mr. Chair. They're using reappropriations to pay for that in both 2025 and 2026.
It's going to cover 2 summers. It's going to cover 24 summers.
Well, I guess I still wonder why the amount is about twice as much than what she recommended.
As we looked at it, it will cover summers of 2024, 2025, and 2026. I think it was just the way that the accounting was done, as I'm hearing from my research team. I do remember that when we were going through this in committee.
So there's actually amounts due for 2020, fiscal year 2024?
Correct. That's correct.
All right. Representative Sutton.
Thank you, Mr. Chair. I want to focus for just a minute there on item number 3, the caseload estimates. Was there any discussion? And let me preface this by saying I don't expect that there was discussion on this, but I'm recommending perhaps there could be in the future. Discussion regarding the caseload estimates. I've always been told that these numbers reflect more people are sick or they're sicker than we previously expected them to be. However, it's recently come to light that perhaps the Medicaid services have been expanded in ways that weren't legislatively approved. And so I'm asking if any of that was mentioned in committee, or could you look into that in the future?
Thank you for the question. I would tell you that the question about legislative approval, no, there wasn't any discussion about that. There was discussion about when these caseload adjustments come in, not only for this budget, but for KDHE or any other budget that would have that impact. And as I understand it, it's timing more than anything else. Those caseload estimates are not available at the time when some of these are being prepared. However, we will take that information under advisement. Thank you.
Representative Sutton.
That's all I've got on that one, although I do have some speculation as to the timing as well. I'm not going to go into that one right now. Thank you.
Representative Carpenter.
Thank you, Mr. Chair. For you that have been on this committee for a while, you've heard me rail about caseloads for years. And it really, it started one year when I chaired the social services budget, and I had to do $440 million worth of caseload increases, and I had nothing to explain, but it's a capitation rate and it's a per member per month fee. And if you remember, I followed up the next year with a proviso in the budget to allow the legislation, certain members of the committee, the appropriations and stuff like that, to participate in the caseload estimates, because what they do, they come out they're in the fall and they're in the spring, and they come out and KLRD is involved with it, and the actuaries from KDHE are involved in it, and the MCOs. We have nothing in that process. We just get the bill. I've railed on this for years. They wouldn't meet with me on that proviso that I had in the budget. They said, hey, if you're going to be here, the actuaries aren't going to show up. So that's been a deal of mine for years, and I appreciate it, and it's going to go through here, and I'm glad you brought it up the first time, because we just have to fund those, and it's very unfortunate we have no oversight or nothing in that process of the negotiation to know anything other than here's the bill. So I'm sorry about rambling like that, but it's a pet peeve of mine from years ago. Thank you, Mr. Chairman.
Vice Chair Williams.
Thank you, Mr. Chair. I wanted to talk a little bit about the EBT program that was started in 2024, and I just did a quick Google search, and it doesn't look like even half of our states may be participating in that. I don't know if the committee discussed that. My concern with the expansion of this program is, well, twofold, really. Number one, is this really kind of correlating with the school lunch program where we were providing after COVID school lunches in the summertime. Is there any correlation to that particular program? And once that went away, then they implemented this EBT program. My second question on that would be, so we already provide SNAP benefits to all children that their families have meet the federal poverty line guidelines. So what is it that requires an additional amount? And then thirdly, on that note, is probably something you didn't dig into, but I do think it's worth it. DCF providing a response back. But of those dollars, how are they being expended? Is there any way for us to get, I know that it's an EBT card, so is there any way to understand or ascertain that they are getting the healthy food? We had a very robust debate about school lunches and making sure that they have healthy foods. Is there any way that we can actually determine if that's happening, or is it soda pop and junk food?
Chairman Bueller.
Thank you for the question. I'm going to hold on I'm going to call it the accountability portion of it, but I'll kind of ladder back up to what I think I heard you say. This is not the same program as the summer food program that provides free meals to children in low-income areas through eligible organizations. The Consolidated Appropriations Act of 2023 is what authorized the permanent nationwide summer electronic benefit transfer, summer EBT program, beginning in fiscal year 24. In Kansas, this had been implemented as the summer nutrition program. This program replaces the pandemic EBT or PEBT program, which provided SNAP benefits to families with children in care of schools, which were closed due to the pandemic. The summer EBT program will provide SNAP benefits to eligible families during the summer months when schools were not in session. So a little bit confusing, but that's the rationale and the logic. So eligibility for the summer EBT is a combination of direct certification and family application. The agency states that the majority of families are approved through uses and information provided by schools regarding children receiving free lunches. So there's maybe the tie. Certification is also provided for school-age children receiving TANF, food assistance, or who are in foster care. Additionally, an application process is set up to allow eligible families not identified through the direct certification process to apply for benefits. So there is an application process where recipients have to be proactive to receive the benefits. And again, I'm not sure if I answered your question on cost or if there's still a question out there that we need to do some further research on.
Vice Chair Williams.
Thank you, Mr. Chair. And I don't know if you'll be able to provide that today, so I do understand, but I think overall the question is the expansion of the program. Why the expansion of the program? Do we not provide adequate SNAP benefits throughout the year? I understand that they're home in the summer, but there still should be adequate benefits. There are quite a few states that do not participate in this expansion. And so I guess if we don't know how that's being spent, then it probably is highly wasteful spending, in my opinion.
So
thank you.
What I take from that, if I may, Mr. Chair.
Chairman Bueller.
What I take from that is if we can follow up and get accounting provided, get accounting for how the dollars are expended, that's one ask. And then and maybe that's where we start, and then come back to that, if that would satisfy the intent.
Any further discussion in regards to fiscal year 2025? All right, seeing none. Chairman Bueller, you may move on to 2026.
Okay. Thank you, Mr. Chair. So moving into FY26, from a total dollars spent perspective, it's a very similar story to FY25. So if you look at the total spending, the agency line item is little over $1 billion, $1.025 billion. The LBC's total spend is about $24 million less than that, and the House committees, when I go through our budget proposal, you'll see that we are about 24 million, or 20 million less, pardon me, than what the first two were. So as you can see, for the sake of time, I'm not going to go through, unless you want me to, 1 through 12 on the agency's ads, because when you flip the page and go to the LBC, you're going to see that the LBC concurred with the agency's budget with the following revisions. There's a deletion of 9.7 million all funds, including 7 million SGF for FY26 as part of the global motion to delete all enhancement requests for FY26. An additional deletion of 14.1 million all funds, including the deletion of SGF, 8.1 SGF, and then adding 400,000 TANF to adopt the fall human services caseload estimate for FY26. So if that's the starting point for and it was the House Committee on Social Services budget, we concurred with the LBC's recommendation for FY26 with the following 5 adjustments. And the first one, Mr. Chair, is precisely what we talked about, the questions on 2025. It's the summer EBT program. A little bit of additional information. There's $100,000 to replace EBT benefits which have been lost or stolen due to skimming or other fraudulent activities. The agency did indicate, and I don't have them at top of mind right now, efforts are underway to prevent and reduce those fraudulent uses of the program. Additionally, we were going to add language to lapse any unspent monies from the summer EBT program for FY26. The second one was a recommendation from the agency, and it's to add the $883, including 380 SGF in FY26 to purchase 800 licenses for a client management software. Well, this was deleted by the LBC when we met with the agency. This program is this will finish the licensing process. So these are funds needed to complete this agency request. The third one was to add SGF, $600,000 SGF in one-time funding to the Vocational Rehabilitation Aid and Assistance account for an organization to provide home-based services to individuals who are blind or have low vision for FY26. That provider is Envision. I have detail on that, and I can answer that. These services were moved from the state budget 15 years ago and include home-based services for independent living skills training, white cane training, mental health support, and assistive training for all ages. I have much more detail on, but that's what number 3 is. It is services for the blind. Number 4. Add $300,000 in one-time funding, all from TANF, or Temporary Assistance for Needy Families, a block grant for an organization to provide community-based and school-based one-to-one mentoring youth ages 6 to 25. That is a request that came in from Big Brothers Big Sisters, and I have detail on that. And finally, the last one is to add $215,000 in one-time funding to the Vocational Rehabilitation Aid and Assistance account for the purpose of operating a pilot project with the Cerebral Palsy Research Foundation of Kansas. The project is called GILA, or HELA, Guided Independent Living Assessment. It's a program to assist young adults with disabilities in developing life skills for FY26. And actually, this one is the continuation of and the finishing of a pilot that is in conjunction with Wichita State University. And again, this program is to get people with cerebral palsy. It's a pilot to where they can learn to live independently. And I have much more detail on that if the committee desires. And with that, Mr. Chair, I stand for questions.
All right, committee, any questions in regards to 2026? Vice Chair Williams.
Thank you, Mr. Chair. Thank you, Mr. Chair. Did your committee have any discussions about trying to identify fraud? You mentioned it briefly, so overall, in any of the programs?
Chairman Bueller.
There weren't any specific requests to go back to the agencies. I do recall that there was dialogue back and forth if the word fraud came about, but there was no specific to-dos to go back to the agencies to provide any additional information on fraud or fraudulent-based activities.
Vice Chair Williams.
Thank you, Mr. Chair. Considering the investment that we are making for, let's say, the summer EBT program, we're not sure exactly how those expenditures are being used, if they're being used for healthy food provisions for our children, and if those children are truly qualifying. But something did come to our awareness, and I would make a motion, requires no no money on it, but basically what that is any changes in eligibility requirements shall be exchanged between agencies, and in this case, specifically SNAP, DCF SNAP program, can share eligibility changes with Medicaid in KDHE, and KDHE can share that information. Apparently, they are not allowed through rules and regs to communicate with one another. So therefore, you're going to catch a lot of fraud if there is constant communication and we are providing, the funds where they need to be and not to those that do not qualify. So that is my motion, to allow our agencies to communicate their eligibility requirements, and specifically SNAP and Medicaid programs.
All right, committee, you've heard the motion. Is there a second on the motion? Seconded by Representative Wassinger. Discussion. Representative Ballard.
May I, may I ask who is not allowing it, please?
Vice Chair Williams.
The executive branch.
The executive branch is not.
Representative Ballard.
I'm okay with that, because I think they should be able to talk to each other about what those requirements are. You're not saying eliminating, you're just saying be able to work together on that issue.
Vice Chair Williams.
Yes, I am, and I should add on to this, because it's not just that they should be communicating, but they also should be maintaining accurate deployment of benefits. So I think you could curtail doing any type of correction by just sharing the information, but it has to be the next step too. They have to accurately deploy those benefits. So that would be my only adjustment to that motion.
Okay. Thank you
Chairman
very
Bueller.
much.
Yeah, thank you, Mr. Chair. We can do that. I think, given the pace of the session and the time remaining, I think we can initiate some activity in committee, at least call it in the military RFI, request for information. We can work that.
All right. Representative Hoy.
Thank you, Mr. Chair. For clarification, is this sharing eligibility requirements or lists of people who are eligible for requirements, like names?
Vice Chair Williams.
Apologies, I was talking to our revisor. Would you please repeat?
Yes. Oh,
Representative Hoy.
thank you, Mr. Chair. Is this sharing lists of eligibility requirements or lists of names of people who are eligible for the requirements and receiving those?
Vice Chair Williams.
Obviously, all of this information is already known to the agencies. They have to have the names, the addresses, the individuals in order to deploy the resources. It's not available to you and I, but it is available inside the agency, and it is very important. I would say that it needs to be subject to federal requirements. We wouldn't want to require them to do something that the federal government disallows. But between the agencies, they should be able to speak to one another about those recipients.
Any further discussion in regards to the motion? All right. Seeing none, Vice Chair Williams, you may close.
All right, thank you, Mr. Chair. So I am going to close on the requirement that these agencies shall exchange information, specifically the SNAP and Medicaid program, on an ongoing basis to maintain accurate deployment of benefits subject to federal requirements.
All right, committee, you've heard the motion. All those in favor of the motion say aye. Aye. Opposed? No. The ayes appear to have it. Ayes do have it. Motion passes. We're back on the budget for 2026. Further discussion for the chairman. Seeing none, Chairman Bueller.
Thank you, Mr. Chairman. I move the Social Services Budget Committee recommendations for the Department of Children and Families budget for fiscal years 2025 and 2026 as amended.
All right, committee, you've heard the motion. Second by Representative Ballard. All those in favor of the motion say aye. Aye. Opposed? All right, motion passes. Chairman Bueller.
1 second, Mr. Chair, while I reset my folders. Thank you, Mr. Chair. I'm going to dive right into FY 2025, similar to the way we just did DCF, and I guess like to direct everybody's attention to the bottom line spending, excuse me, for the agency LBC in the House. So this is a $4.1 billion agency, and that agency request. LBC came in at roughly $100 million less at $4.042 billion, and the House Social Services budget came in slightly higher than that at $4.051 million. So and then I would go into the agencies submitted their revised request of $4.1 billion, including $971 million SGF for FY 2025. It's an all funds increase of $13 million, or less than 0.3%, including an SGF decrease of $12.1 million, or 1.2 below the amount approved by the 2024 legislature. The SGF decrease is attributable to a lapse of $19.7 million SGF that was reappropriated from 2024 from the CHIP program. Decrease was partially offset by the agency's supplemental request totaling $7.6 million SGF. The all funds decrease was offset by an increase in federal funding for immunizations and epidemiology and laboratory capacity. One thing that you'll see as we go into 2025 and 26, the revised estimate includes 1,440 FTE positions, which reflects an increase of 46.9 FTE positions approved by above the number approved by the 2024 legislature. So the LBC concurs with the agency's revised estimate with the following deletions. And since they are 1 through 5, unless anyone wants to go through the LBC's deletions, I will just stand as those are written and then roll into the LBC's budget report. We concur with the LBC's budget recommendation of FY 2025 with the following adjustments. And number one is something that you will also see in 2026. So the Budget Committee added back 30 of the 46 positions that, because they're funded entirely with federal funds, and I have the breakdown of all of those 30 jobs if anybody wants to see them. They range from coordinator, program manager, coordinator, epidemiologist, chemist. So there's a variety of those 30 federal funded positions. So that's the rationale the committee used in both 2025 and 2026 to add back those 30 positions. The second recommendation for 2025 is to add $9 million of SGF for approved projects using the 10% enhanced federal match in FY 2025. These funds were reappropriated in FY 25 and lapsed in House Bill 2007. So the bottom line on this $9 million is if we don't use these money, we have to pay the federal government back. So, and I've got, I think, some additional detail on that. The third item is to add $253,684 SGF for the Stan Clark Pregnancy Maintenance Initiative in FY 2025. These funds were reappropriated into FY 2025 and lapsed in House Bill 2007. Pardon me. The Stan Clark Pregnancy Maintenance Initiative is not new. It's been funded in the past, so we're adding those funds back. And with that, I stand for questions on FY 2025.
All right, thank you, Chairman. Committee, questions in regards to fiscal year 2025. Representative Mosier.
Thank you, Mr. Chair. Chair Bueller, on your number one add back, how long will these employees stay on board? Is this going to be an ongoing, are federal funds going to come down every year to keep these people employed, or what's that part of the equation? Thank you.
Chairman Bueller.
I can't answer for all of all 30 of the jobs, but I know they will be funded by the federal government for as long as the grants are in place. So at some point, at least at this point, there's no compromise of state funding, so it's all federal funding until the grants run out.
Representative Mosier.
Thank you.
Vice Chair Williams.
Thank you, Mr. Chair. And this may be more of a question for the analysts and something maybe you can clarify when we're looking at the FTEs on the first page. It looks like that there's 9 that are added. Yet you say that we're adding 30 FTE federal. So just for reporting purposes, how does that work out?
Chairman Bueller.
actuals. So this is what they've asked for, and this is their actuals.
Okay. So
Vice
Take
Chair.
that back. I was looking on 2025 instead of 2026. Thank you.
Any further discussion in fiscal year 2025? All right, seeing none, Chairman Bueller, move on to 2026.
Thank you, Mr. Chair. Need to get my pages correct here. Okay, and I would recommend the same starting point and start look at the total funds for agency, LBC, and House, because you'll see a difference. And this is where, like DCF before, we talk about the fall caseload estimates coming back in to radically jump up the total dollars spent. So the agency's request is $4.044 billion. Excuse me. The LBC came in at $4.113 billion, and the House Budget Committee is at $4.18. So the agency requests $4.0 billion, including $918 million SGF for FY26. The agency request also will go into that same 30 increase of 30 FT positions that are federally funded. I guess before I get into any more of the detail, this is one of the budgets, much like you'll hear on KDADS. When we get into the recommendations of the committee, I want to kind of set the stage. We had, in addition to the agency's budget request and hearings on that, we had over 40 individual conferees who showed up and made requests to my budget committee. Representative Ballard is saying 43. It was a long day. There were additionally about 40 written proposals that came in as well. So we had a tremendous amount of ask for this committee. And what we tried to be is diligent with the state's funds and still respond to the needs that are out there. So that's kind of place setting. So I'll go into the special committee on legislative budget. We did concur with that budget position. I'm not going to go through 1 through 9, which is the recommendations made by that committee. But I would turn your attention to the LBC item number 11, which is where it adds back $108.8 million, including $56.1 million SGF, to adopt the fall human services caseloads estimate for FY 2026. And this is, and you see that in the bottom line spending for both the LBC and the Budget Committee recommendation. Okay, so that's kind of the starting point. Moving into the Social Services Budget Committee's recommendation, we concur with LBC for FY26 with the following adjustments. We've added back the 30 FT positions that we talked about for 2025. 2 and 3, number 2 is one of the heavy lifts, and we'll have discussion on this one. Add $44.3 million, including $16.9 million SGF, to increase Medicaid dental rates for FY 2026, and add language directing the agency to compile data on provider enrollment and utilization before and after the rate increase. When I go through this budget, this is one of the ones where we took hard looks at Medicaid, and that was the size of the ask that came through the committee. Number 3, add $1.1 million, including $420 SGF, to raise vagus nerve stimulation implants. I do have additional information on each of these items if and when the committee is ready for discussion. Number 4 is to add $263,000 to support the Cerebral Palsy Research Foundation of Kansas in Wichita for FY 2026. 5 and 6 go together, where we add $215,000, including $82,000 SGF and any add-on language for the state Medicaid program to provide reimbursement for diagnostic evaluations for complex wheelchairs. We're also going to intend to add language to eliminate any requirement of prior authorization for complex needs for wheelchairs when the individual has received a prescription and been evaluated at a specialized wheelchair seating clinic. Number 7 is another dentistry add, where we added $1.9 million, including $742,000 SGF, to increase the rate of dentistry code. This is for sedation dentistry, from $1,722 to $2,500. If you think of patients in this one who have severe forms of autism or I know of one parent in Kansas who has a daughter with, is quadriplegic with cerebral palsy, cannot go through a normal dental cleaning. It requires sedation. That's what this number 7 is for. Number 8 and 9 are also related. Transfer $8.7 million in interest from the HCAP program to the State General Fund. The other part of that is adding $10 million for hospitals providing inpatient behavioral services for adults in FY 2026. Those hospitals have been involved. This isn't anything new for them. Number 10, adding $2.7 million, including $1 million SGF to increase Medicaid reimbursement rates for sick and acute pediatric visits. Number 11, add $632,000, including $242,000 SGF and language instructing the agency to implement CPT, this is the code 9943, to add cognitive assessment, care, and planning for individuals with Alzheimer's. This is an early Alzheimer's diagnostic code, which is designed to, this one actually pays back if it prevents 21 hospital visits by the 485 patients with this condition in the state. And each one of those persons in the state averages 2 hospital visits a year. So this one pays for itself in less than a year. Number 12, this is a program that has about a 1,500% payback, if I remember correctly. At $5,500 SGF for the donated dental services program that provides services to those with disabilities and/or the medically fragile who lack dental coverage. We are lucky to have a dentist on our committee, and those dentists who provide donated dental services for every dollar I think they donate, it's about a $1,500 payback is the way it was stated. Number 13, add $550,000 SGF to fund project access, healthcare access, and the Wyandotte Johnson County Care for FY26. These programs donated health care for low-income and uninsured residents for Sedgwick, Wyandotte, and Johnson counties. Number 14, 15, 16 are all language. So number 14 is to direct agencies to raise the protected income level for medically needed population to 100% of Social Security income and to fund the increase using existing resources. Excuse me. Number 15 is to add language that interest earnings attributable to the SGF credit received will not be transferred from the SGF to the HCAP program. In addition, add language to limit the amount credited to the fund to 80% of the amount estimated to be received by the provider assessment, and that the director of the budget will calculate the amount of interest deposited into the HCAP fund for FY25 and transfer the amount to SGF FY26. And I'll be honest, if you need help on this one, I would direct you to Representative Carpenter, because I'm not your guy on this one.
There goes the bus.
Yeah, my bus driving license is up to date. Number 16, add language to the critical access hospitals and rural emergency hospitals, pay the provider assessment in the healthcare or the HCAP program if they have annual revenues that are above the threshold established by the Healthcare Access Improvement Panel. And 17, add $6.2 million, including $2.5 SGF to raise the cognitive rehabilitative. This is the brain injury waiver. What it does is it raises that rate from $18.99 to $25 per hour. This recommendation passed during the committee. Recommendation from KDHE. Phone a friend on this one. I need to go ahead and go with this one.
Well,
This is
so,
one with deleting.
well, it's up to the committee because it did pass under KDHE, but then we tried it under KDADS and it didn't, so they can do what they.
All right. Pardon me, that was a little bit of a technical assistance question there. This did pass in committee, but the item is funded or would be funded under KDADS. So the motion was made during the KDADS budget hearing there and it failed. So I just wanted to put that out there for this particular one. So with that, I'll stand for questions on these. I know that is an awful lot. I'll try to respond to these as best I can. What I would ask, if you have a question on our budget recommendation for 26, if you will direct me to the number, it will help me orient to the materials that I brought to answer the questions.
So I want to focus on item number 17. Do we need to make a corrective measure then in the budget and move that to KDADS as opposed to the KDHE budget?
Thank you for the question, Mr. Chair. Yes, that would be what we, excuse me, what we would need to do.
Could you explain why it passed under the KDHE budget and then failed in KDADS?
I
Was
would
it
go
looking
back
at being
to,
like duplicative or?
no, it was, I'm going to say it was nothing more than just simple human error. In the span of 2 or 3 days, and I would go back to the number of hearings that we held and the flurry of recommendations that came in, trying to sort those with the right agency, it was one that got out of whack.
All right, well, then I would make a motion then, and Jill, you can work on the language on how we need to have that corrected in the budget, since it's actually a KDADS funded item. Just wait till we do the KDADS budget. Delete it from here and then add it to KDADS. Right, well, we need to have it, the corrected, or the appropriate funding mechanism. So I'll make that motion. Is there a second? Seconded by Representative Ballard. Is there any discussion on the motions? We have this corrected? All right, seeing none, I close on my motion. All those in favor of the motion say aye.
Aye.
Opposed? All right, motion passes. One thing I wanted to go back, and I know it was not a recommendation by your committee, but it was in both 25 and 26 under the governor's recommendations on the Gainwell contract increase. She had the full funding in 25 and then the full funding in 26, but it's not a recommendation on your committee. I just kind of wanted to see what the discussion was in regards to that particular item. Chairman Bueller.
Thank you, Mr. Chair, for the question. We heard the request and the recommendation when we had the budget hearing. There was not enough support in the committee to fund that. As simple as that.
Any particular reason or?
Not that I can recall off the top of my head. I do have 2 of my committee members here. They're both shaking their head in the negative, unless Representative Ballard can answer the question.
Representative Ballard.
I think we made a case for it, but it went down on 1 vote.
Thank you for the elaboration. All right, I'll leave it at that. Vice Chair Williams.
Thank you, Mr. Chair. Can you, so that I don't have to do the math, can you give us the differential between the governor's enhancements and the committee's enhancements?
Chairman Bueller. And there will be a somewhat discrepancy because she does have Medicaid expansion in her budget. But Chairman Bueller, if you could answer the question by the Vice Chair.
I don't know if I have that off with me at the top of my head. I'm going to look over to my revisers, friends, or research friends and see if we have that. Yeah. That might take a little bit.
Okay, no problem. My next question is, I just have 3 questions. My next question relates to reimbursement rates, really overall. So can you just clarify, the federal government sets reimbursement rates. In the past few years, we have increased reimbursement rates on various types of services. But, and here we're going to do it again for item number 2. So when we increase our rates, does the federal government, through the Medicaid program, still give us the same match, even on the % that we increase?
Chairman Bueller.
Yeah. The answer to that question is yes. And with request to this particular one, when we looked at this request, this one was based on what surrounding states are providing. And that's how this one came to be. So, for example, in Kansas, only 30% of dentists actually bill Medicaid. Some of that, a recent rate increase in Missouri to dental rates led to a 43% rise in provider participation in their program. In 2024, we added, as a legislature, $4.8 million, including $1.9 in SGF. In 2025, we added $1.2. The testimony itself was geared toward or designed toward getting greater participation in dentistry in Medicaid in the state. And I don't know if any of my committee friends have anything to add to that, but that was the reason this one came to bear.
You keep eyeing at Representative Carpenter. So, Representative Carpenter.
I think the chairman did a great job of explaining it. It's about participation by Medicaid folks. I know it's a big lift. Yeah, that's all I'll say about that.
Vice Chair Williams.
Thank you, Mr. Chair. Last question, partially comment, but partially question. Thank you for providing the list of the 30 new jobs. My concern is, we're adding, this is federal government work, expanding right into us. This is why we have a national debt. This is why we have an annual deficit of $2 trillion. And I'm looking at this list and I'm just like blown away. Like, for example, we have a Wise Woman program. We have a population health strategies section. We have a complex commercial childcare application for daycares that we have to help with that. Then we have another one for childcare. We have a conduct Spanish and English phone surveys. We've got one that relates to consulting, including school health. So I guess my question is, I did not realize, so these are just, I'm assuming then these are grant programs, not Medicaid. And so they're just saying, here, have it. And coming back to Representative Mosier's question, I'm super concerned that this is going to just add on to our budget long-term. We're never going to realize that. And so I guess my question is, did you look at these positions in your committee to determine, do we even want these positions?
Chairman Bueller.
Thank you for the question. We didn't look at it that way. Quite honestly, it was, what are the jobs? Are we paying for them? Are we on the hook on them? There was no appetite of the committee to be on the hook for some program that will eventually, or job that would transfer from federal to state. So I understand that. But it was because they were federally funded. And when they come under the headers of family health, public health, health promotion, that was the rationale, right or wrong.
Vice Chair Williams.
Thank you. And just a last comment, I have made this comment before, but when our constituents are impacted by some of these positions, some of the surveys that go out, I remember the surveys that went to my constituents asking about their sexual preferences. That was probably in 2021, 2022. Those were federal grants. And so I would love, when time allows, because we don't have the time at the moment, to really dig into the federal monies that are coming into Kansas that are influencing policy, that are touching the lives of our constituents, and perhaps not in a beneficial way. And maybe we shouldn't take all of these monies. Maybe we should do our part and reject it and send it back to the federal government and say, no, thank you, and we don't want to have any part of, increasing our annual deficit. So just a thought. Thank you.
Representative Sutton.
Thank you, Mr. Chair. I want to turn attention to items 5 and 6. I think we're heading down a dangerous pathway here. Now, 5, first off, this is of the committee recommendations. 5, I think I can go along with, but when we start talking about changing insurance policy in a budget committee, that's a terrible idea. That needs a hearing, that needs to be sussed out in a great deal more detail. Number 5, I can go along with because I don't believe there's actually prior authorization required for a battery change. I know we hear the stories, but in real life, no, there's not. They might seek prior authorization, but it's not actually required prior authorization for a battery change. But so I can go along with 5 being included because it's not actually, I don't think it's actually going to be impactful. Number 6, however, is. And whenever we start saying, oh, no, we're going to grant anyone and everyone the ability to provide any sort of wheelchair, whether it's medically required or not, that's a terrible thing to do in a budget. If you want to do it, that's fine. We can run a bill. We can actually have a hearing and have everyone testify involved in the process. But to throw this into a budget, throw a policy piece like that into a budget is inappropriate, and I think it's just not prudent to do in a budget hearing. You'll notice last year we had something along the same lines where we threw 340B into a budget on the floor. Well, it got thrown out in court because it was stupid. And that's a technical term. That got tossed because it was unenforceable. I mean, we didn't have the structure in order to do it. And that's kind of the problem that I have with this. So I would move to strike number 6 from the budget recommendations of the House Budget Committee.
All right, committee, you've heard the motion. Is there a second? Second by Representative Tarwater. Discussion on the motion. Representative Carpenter.
Thank you, Representative. I think that's a good catch, but I think we're trying to send a statement here, and we will be talking about this in Can-Care oversight. I know this is not prudent or smart or the way to do this, but it's a way to send a message. And let me explain to you what the wheelchair folks are up against. So they get a call from a client, and their wheelchair's broke. And they're out there, you know, maybe 100 miles away or whatever. They go out there, they have a van that has all the parts on their van that they could fix this wheelchair. They cannot fix that wheelchair without coming back to the shop, filing a prior auth, waiting a month or however long that takes, getting the prior auth, maybe it's denied, and maybe they don't get it for another month. These folks live in these wheelchairs. And then they come back with the prior auth, and then they drive back out there, and they fix the wheelchair. That's the statement that we're trying to make about this. How ridiculous is that? And they don't get paid but one trip. So I get it. I know we're on slippery slope. We'll be addressing it in Can-Care oversight here in the next week or so, but that's the reason for that. Thank you.
Representative Sutton.
Thank you, Mr. Chair. And I don't disagree with you one bit, particularly on number 6. I too have heard the concern, and we've isolated perhaps 2 bad actors in our Can-Care provider MCOs. I think this problem has already either been fixed or will be very, very soon fixed. Like I said, it was one provider that was doing it, 2 people perhaps. We're still working on that part. But the method of solving that isn't to change policy. I agree that there's been an issue. I'm hopeful that we've solved that issue already, but I would much prefer to solve it that way than to change our overall policy for the purchase of items.
Representative Carpenter.
Thank you for that. I just wanted a chance to get up on a soapbox and provide why we put that in there. So now everybody knows. So thank you for that.
Vice Chair Williams.
Thank you, Mr. Chair. On this conversation here, and perhaps rather than directing it to the maker of the motion, maybe directing it to the chair or the vice chair, but really there's 3 questions here. It says here it has received a prescription. It doesn't say anything about repairs. So I'm wondering, is this about an initial, can we exclude first-time prescriptions? Is that what we're trying to do? Or are you trying to do the repairs, which is not mentioned in this proviso at all? And secondly, you mentioned prior authorizations. Are you saying that the prior authorizations are required for repair? And then the last one is, who would be the specialized wheelchair seating clinics? Are there only a few that are allowed to do this, or are we going to include any new entity that might take advantage of this opportunity?
Chairman Bueller, or
I'll defer to Representative
Carpenter.
He's itching to go.
Thank you, Mr. Chair. There are 4 in the state that do this, CPRF being one. There's Scott Lopez out of Kansas City. There's another guy that testified. There are. And could you repeat? Again, this is more of a shot across the bow, Representative. I'm not sure the prescription part of it or any of that kind of stuff. I don't even believe that we have the authority or want the authority, but it's a way of bringing awareness to the issue, and I appreciate Representative Sutton bringing that up. So we plan on, when it deletes, it'll go away. But I don't think it's the prescription part. It is the repair, though, in fact. It is the repair that they have to get prior auth for that repair.
Vice Chair Williams.
Thank you, Mr. Chair. Then I think that we should change the language of the proviso to actually designate what you're trying to accomplish rather than, maybe we could say excluding first-time prescriptions. Maybe that would help the situation because I would like to capture the repair. That seems.
The way I understand the motion, oh, sorry, Mr. Chairman.
Representative Carpenter.
The way I understand the motion is it's stripped completely out, so it doesn't really matter if we have repairs or whatever in there.
But there is language in item number 5 that specifically says repairs of any complex wheelchair. So I think that's covered in 5. Vice Chair Williams?
No, I'm fine. I just was looking at number 6 and didn't see number 5, but just wanted to make sure we were excluding first-time prescriptions.
Representative Estes?
I don't think there's a much opportunity of first-time prescriptions because the clients have to go in. There's a very detailed, complex measurement system because these are custom-made to their unique body and their needs. So I think that's okay. And I understand that we don't normally want to do this way, but I think we also campaign at times on saying, hey, can we just do some things that are common sense? And I think this, in my mind, for me, falls in the common sense exception because the companies that do service the wheelchairs are going out of business because they only get paid for the one trip. And it forces them to charge a higher price, and it slows down helping that person enjoy the full happiness of their life that they have. So I'd really like to keep this language. I think having it as a proviso kind of has a sunset in it while we work out the other things. And we don't know how the other things that the other representative is hoping are resolved are ultimately going to do. So this kind of gives us a fallback position for now.
Chairman Bueller.
Thank you, Mr. Chair. And again, maybe I should have said this before, and it resets, helps the committee reset who these wheelchairs are for. It's for people with spinal cord injuries, traumatic brain injury, cerebral palsy, ALS or Lou Gehrig's syndrome, multiple sclerosis, and spina bifida. These are people who live in these wheelchairs. So that's what we're talking about. Thank you, Mr. Chair.
Representative Tarwater.
Thank you, Mr. Chairman. Sorry. So I just want to be clear, we are leaving in the repair part. This is only removes the prior auth, the automatic prior auth on new wheelchairs. So, Mr. Chairman, this is prior authorization for these expensive items is one of the tools that we have to keep Medicaid costs down. And with estimated fraud in the Medicaid system of being in the 40%, 30 to 40% range, possibly, some of the reports come back that's the kind of fraud that's out there. I think that we do need to take the time to look at these expensive items to make sure that that this is actually needed. And so I'm going to support my friend down there on this. Thanks.
Representative Howe.
Thank you, Mr. Chairman. I appreciate the discussion here, but I'm going to oppose the motion. I want to support my budget chair on this and trust their judgment. Sometimes it is good to send a shot across the bow, and I think this is an opportunity to stand up for, the little guy. I mean, who's out there trying to get a chair fixed and going through a delay of some sort. This isn't the last train out of the station. So I think we keep it in there, put the pressure on, and then if we have to modify it later on in the process, we have that opportunity. Thank you, Mr. Chair.
Representative Ballard.
Thank you, Mr. Chairman. I would like to ask you if you would consider not removing this and give us an opportunity on CanCare, because we do plan to discuss it. The testimony indicated, because they do live in these chairs, and there's such a time frame in between, that it's crucial for them. I understand what you're saying about 6. But again, I'll say, we're going to look at it, and removing it now, when we meet on Friday, next Friday, that it would give us that opportunity to do that, and we could come up with a solution. And if it's not acceptable, then I would say do something else.
Representative Sutton?
Okay, let's look at the procedure here. Okay, first off, policy in a budget, bad idea. Bad idea. You don't want to go down this road, I'm telling you. However, since we've opened this can of worms, first off, clarify repairs, whatever prior authorization may or may not be required on repairs, I'm keeping that in there. We're talking about only new prescriptions. That's the only thing we're talking about. Now, as to the other, yes, I'll be in that meeting as well for the CanCare oversight. And yeah, I absolutely plan on looking at this. However, I don't think that you feel like the Bob Bethel Committee is going to have access to the budget. So because of that, we need to remove it here, have that discussion in Bob Bethel. If we want to run a policy piece separately from a budget, heck, I might even support it. I don't know. Let's see what it looks like. But I'm not opposed to the idea, but to do it in a budget that we don't have access to in the Bethel Committee doesn't make sense to me at all. This is procedurally just all over the map. And so if we're going to keep this flowing in the direction that legislation is supposed to flow in a relatively tidy manner, then we need to remove it here, discuss it in the Bethel Committee, and if necessary, run a policy piece from there, not a policy piece shoved into a hastily written budget report.
Representative Carpenter.
Thank you, Mr. Chair, and I agree with the previous representative. I think the message was received, and that's all I wanted to do was make everybody aware of how ludicrous this was, that was the process. So as far as I'm concerned, I don't care if it's in there or out. MCOs are listening. They heard how ridiculous it is, and mission accomplished.
Any further discussion on the motion? Seeing none, Representative Sutton, you may close.
We've beat this horse. I close.
All right, committee, you've heard the motion. All those in favor say aye. Aye. Opposed? The ayes appear to have it. Ayes do have it. Motion passes. We're back on the budget. Discussion on fiscal year 2026. Representative Tarwater.
Thank you, Mr. Chairman. I had a question regarding the increase in dental rates. Are we keeping the program as it is, or are we expanding it to more adults, or is it the same program, just a higher reimbursement level?
Chairman Bueller.
It's the same program, just higher reimbursement level.
Okay, Representative Tarwater.
Okay, thank you, sir. And I do have a request, since the caseloads increase every year as they do. In another committee, we were questioning someone from the administration on CanCare 2 versus CanCare 3 or 4 or whatever we're on now, and why it got a lot more expensive. And they did say that they continually increase coverages and change coverages year to year in CanCare, and I would like to know what changed between CanCare last year and CanCare this year, coverage-wise, if we can get a report from before next week. Because I don't know that they have legislative authorization to increase coverage.
Representative Carpenter.
Thank you, Mr. Chair. It's only been in effect as of 1st of January, and I have been requesting all that. We really have no idea what the new program will cost, and I'm on top of it. I've been asking it. We just have to have some historical data of claims and that kind of stuff to see what the new cost of the new one is. No, to me, and this is just supposition, it's going to cost more. We just don't have any data to know how much it's going to be when we get until we start developing claims and all that. So we've only had a month under our belt with the new MCO and all that, and the new contract. And I'm keenly aware of that. We asked for estimate of the increased cost with the new one as it came into effect. There was no way to project that. So, but we are on it. I'm aware of it. And if I get any information, I certainly will. And if anybody out there has any more information than that, I'd certainly like to see it too. So thank you.
Representative Tarwater.
All right, yes, thank you for the information. I know it's going to take a while before we experience the difference, and I know that we're going to get a caseload adjustment at the end of the year because of it, and it will be a couple of $100 million I am worried that that's what the number is going to be or more. I'm just simply looking, and the RFP's been out there for a year and a half, 2 years, so we know what coverage has changed. I'm looking for what coverage has changed, not what it's going to cost. We can get to that step when we experience it, but I would like to see how coverage has changed over the years, especially between last year and this year, because I don't, no one in this room authorizes that. It just happens. And then we get a caseload adjustment, and we never ask about it. We're just told we have to pay it because it's a bill. I'd like to know what changed is all. Thank you.
Representative Rogers. Vice Chair Williams.
Thank you, Mr. Chair. And so I would just add on to that, on that list, what was changed through the executive decision, executive branch versus legislative changes such as a reimbursement rate. I'd definitely like to know the difference. I want to know what we're adding to that bucket and what the rules and regs or the agencies are adding.
Any further discussion? And I think we can have research try to get that information as much as they possibly can to us by next week. Any further discussion in regards to 2026? Representative Rogers.
Thank you, Mr. Chairman. I appreciate the discussion on this big part of the budget. Sometimes we spend an hour on $100,000, and I'm glad to dig into this. I just have a couple of questions, Mr. Chairman, if it's all right. Number 9, adding the $10 million for inpatient behavioral health service. This is based on available beds. Is that based on census? How is that based? Because I'm looking, the closest or the farthest west is Salina, and I don't want to get into semantics of who it is, but just I know we're looking for, and did we increase beds as well?
Chairman Bueller.
Thank you, the chair. Thank you for the question. It's essentially the same funding request that was proposed last session to help hospitals sustain the same behavioral bed capacity and more efficient care. So it's an extension of what happened in 2024. For example, from some of the testimony, Ascension via Christie testified that in each of the past fiscal years, they've still been losing $3.5 to $6 million in behavioral sciences. So it's designed to some extent, offset that and maintain the beds that we have. There are 6, I believe, hospitals that have participated in this program. We did add language that all expenditures made from the adult inpatient behavioral services account be directed to the same hospitals that were participating, and they go out to Salina, Hutch, et cetera.
Okay, so
Representative Rogers.
Mr. Chairman. So again, that was a one-time. So this is just there's no additional money. It just expired and needed to be added. So we're really not adding any more beds. We're not. I just want to make sure I fully understand.
Chairman Bueller.
That's correct. Your understanding is correct.
Okay. Mr. Chairman.
Representative Rogers.
Thank you. Number 16, just maybe an explanation. This is critical access hospitals, so on, that, where their annual revenues are, that they cannot participate. I just want, so I have an understanding. I know last year, and I remember exactly where it was, we fought kind of CMS to get those reimbursement rates up for certain things. I don't want to confuse the issue, but just trying to, I have a lot of critical access hospitals in my district, so just maybe explain that so I have an understanding as I talk to them.
Chairman Bueller.
There are 3 bullet points that I would add to this. So currently, the critical access hospitals and rural emergency hospitals are excluded from the HCAP provider assessment. This language that's in number 19 will add these hospitals with certain annual revenues to the program. This language was brought to the committee by the Kansas Hospital Association.
Representative Rogers.
Thank you. I'll follow up with them, so thank you.
Representative Carpenter.
I might follow up just a little bit. There is a budget proviso from last year in there dealing with the first part. This new one includes more critical access hospitals to draw down more federal funds. So it's $58 million worth of new money for the critical access. So it's just a change. Last year's didn't include them because they were exempted for a certain amount of, they had to the cost, and this one goes back to, it's very low for the cost. So it brings in another $58 million for a critical yeah. So, thank you.
Representative Sutton.
Thank you, Mr. Chair. This is one, normally I have some inkling of the answer to a question before I ask it. This one I really don't. On number 9, I'm glad that Representative Rogers brought this up. Are there really only 6 hospitals participating in the behavioral health services program?
Chairman Mueller.
Funding program, whatever this.
For this one, this question was asked specifically in committee. All expenditures be made from the Adult Inpatient Behavioral Health Services account, be directed to Advent Health Shawnee Mission, Ascension Via Christi St. Joseph Campus, Hutchinson Regional Medical Center, Salina Regional Health Center, Stormont Vale Regional Medical Center, and the University of Kansas Health Systems. That is those are the same participants as they were in the previous year as they will be this year.
Representative Sutton.
Thank you. Who decides what hospitals are participating? Does anyone get the opportunity if they just want to throw their hat in the ring? How does this work?
Chairman Bueller.
Those, from what I recall from discussion, from help jogging my memory of those are the hospitals that agreed to work together to do this, and that is an ongoing agreement with them. I wouldn't presuppose that somebody else could be involved in that discussion, but these are the ones that are currently involved.
These are the only ones that we're funding?
Yes, and they agreed to work together to do it. I don't know if anybody else was asked. I don't have any line of sight on that knowledge.
Representative Sutton.
I don't have enough to make a motion on this thing, but I definitely think we need to look into that just a little bit more carefully as to why we chose, or they chose, someone chose a group of hospitals that will get extra money thrown at them, and maybe others would participate and be. Are we actually limiting people from participating in behavioral health services? I don't know. Maybe. I think we need to look at that. Anytime we set something like that up, the optics are bad. The optics aren't good when you pick 7 hospitals and those are the ones that you throw money at. It seems odd to me.
Representative Turk.
Thank you, Mr. Chair. And correct me if I'm wrong, because I slept since last year. So when we discussed this last year, it had to do with their emergency rooms, how many of these particular patients they were taking in, how many they had to hold on to in order to wait for space at, say, Osawatomie or something like that. This was to offset their overhead that was not being compensated. So I do believe there are standards in place, and I don't recall them now because, like, it's a year ago. But we did hear them. They are on record somewhere. So they did have to meet something, X number of inpatient, X number of cost, et cetera.
Vice Chair Williams.
Thank you, Mr. Chair. And I, too, am curious about number 9. I mean, what kind of funding streams are actually paying for these beds? Is this a $10 million that's going to be an ongoing cost, or is it to really help those beds to get up and running, such as, the capital expenses? Disproportional reimbursement rates, are they receiving monies for that, for this type of overnight stay? We're already spending Kansas Medicaid dollars on these, private health insurance. What are the streams for this, and also is it ongoing?
Chairman Bueller, and then Representative Carpenter.
It's compensation for the losses. They are not being compensated through Medicaid and other things. It's the losses that they are incurring to provide these behavioral health services to patients. So it's not there's not some insurance that's covering these. It's uninsured costs. That's what we are covering. They provide behavioral health services, and I think Representative Turk is remembering from the previous year, these hospitals provide those services and they lose money at it. So we have this $10 million of state general funding to help offset those costs.
Representative Carpenter?
Thank you, Mr. Chair. These 6 hospitals are actually the only ones that have adult mental beds. So that's how that works with them. And then, if I could talk to Representative Williams about the number 9. So if you look in the governor's budget, there was $8.7 million worth of interest that was discovered, and it was the first one to the pot of money. And so we can't care oversight, well, not can't care, but the HCAP deal is funded through the federal government, and the states puts in a little money, and then the money sits there until it's distributed out to the hospitals. Well, over the last 2 years, that fund is, that interest fund that they've made on that account has been about $4 million a year. So there was $8.7 million sitting in there that we used to fund the $10 million. So the fact of the matter is that only actually cost $2.3 million to fund that 10. Just a creative way of finding some money. It won't happen again. We have language in here, if you look farther in there, that that money will be swept and put into the state general fund. But this year, in the interest of the Budget Committee and Chairman Bueller trying to be frugal, we swept that account, and that's offsetting the $10 million cost. So thank you.
Any further questions for the chairman in regards to 2026? Representative Mosier.
Thank you, Mr. Chair. If you'll recall our discussion yesterday in the Commerce budget about having the upskilling $1 million put in there, and I think we all mutually decided that maybe Commerce wasn't the place to put an upskilling program. So at this time, I would move to add $1 million to the healthcare upskilling grant program to the KDHE health budget.
Committee, you've heard the motion. Is there a second? Seconded by Representative Rogers. Discussion on the motion. Where is the funding source?
It says EDIF.
So it is EDIF money. Discussion on the motion. Vice Chair Williams.
Thank you. Okay, and I think the EDIF may be underwater at this point. I'm wondering if we can just do SGF. I hate to say that, but I think, yes, a couple days ago, we kind of buried it.
Representative Mosier.
Thank you, Mr. Chair. Yes, and I think because this originally went through Commerce was why they were using EDIF as the funding source. I would agree completely to use SGF at this point.
Is that okay with the second? All right, discussion on the amended motion. Seeing none, Representative Mosier, you may close.
I close.
All right, committee, you've heard the motion. All those in favor of the motion say aye. Aye. Opposed? Motion passes. Representative Amix.
Thank you, Mr. Chairman. And just a clarification on the hospital beds, going back to item number 9. If other hospitals would be able to meet the requirements for making beds available, would they be able to automatically become part of the consortium or of hospitals, or is this just a group that has gone together and put this program together?
Chairman Bueller.
Thank you, Mr. Chair. I think it's because these are the only hospitals that provide these services. I don't know the precise answer to that question, or if any hospital has the willingness to do this, but I'd be happy to look into that further.
I would say by the language that's in the budget or in this particular item, it's just these institutions. It would not be for any other hospital that would happen to provide these services. Any further discussion in regards to 2026? Seeing none, Chairman Bueller.
Thank you, Mr. Chairman. I move the Social Services Budget Committee recommendations for Kansas Department of Health and Environment Health, their budget for fiscal years 2025 and 2026 as amended.
All right, committee, you've heard the motion, seconded by Representative Ballard. All those in favor of the motion say aye. Aye. Opposed? All right, motion passes. Chairman Bueller.
I'm still getting my. KDADS, this go.
Great. We've always thought there were a lot of people that needed mental health services.
No, I don't think that would.
I don't think so either.
One more second, Mr. Chair. Mr. Chair, as I'm getting my stuff ready, I'd like to, if I could have some help from research to pass around a one-pager on the 2018-2024 nursing facility beds closed versus opened.
All right, that's fine.
Okay. Okay, and as
Chairman Bueller.
Thank you, Mr. Chair. So as those are going around, I just want to kind of orient folks to the Budget Committee report again. It was helpful for me and the committee to look at KDADS, similar to the way we did KDHE, is to take a look at and dive into the total funding requested. So the agency came in at 3.5 billion. The LBC came in at closer to 3.6 billion. And the Budget Committee came in about 50 million higher than the LBC did. And again, a big chunk of that, as we discussed with KDHE, is there was an addition of $131 million, including 2.4 in SGF, to adopt the fall human services caseloads revised estimate. So much of the discussion we had, again, KDHE is somewhat applicable here. So the agency requests revised expenditures total 3.5 billion, including 1.5 in SGF. It's a decrease of 111 million, including 165 million in SGF, below the amount approved for the by the 2025 legislature. And again, this was the most heavily participated in the pre-budget committee hearings as far as conferees, testimony, and asked. There were over 45, I think, conferees in this one, plus 40 more written. So, without further ado, the LBC concurs with the agency's revised estimate in FY25 with the following adjustments. I won't go through 1 through 4. I think those are self-explanatory, but again, I would draw your attention to adding the 131 million, including 2.4 million SGF, to adopt the fall human services caseload estimate. The Budget Committee concurs with the LBC's recommendation for FY25 with the following adjustment. So, number one is we're adding 45 million to the SGF to restore lapsed reappropriations for the HCBS 10% enhanced FMAP savings for FY25. This is another use it or pay the federal government back scenario. I have a breakdown of where this $45 million is going. Some of it's $10 million, for example, in technology first grants. But again, the highlight on number one here is if the funds are not spent within CMS guidelines, the funds must be returned to the federal government. All right, item number 2 for FY 2025 is adding $140,000 SGF to provide in-home services to lower income older individuals for FY25. This is a program called Nursing Homes Without Walls. And this is, the design is to be a cost savings actually for the state of Kansas. So they use daily remote patient monitoring for chronic disease management, and AI-based activity motion monitoring, voice-activated communications to facilitate mental well-being and safety for the consumers residing in an HCBS setting. It is a pilot program, and if it's successful, they would apply to the CMS to add these services. So again, think of keeping somebody out of the nursing home and having their health monitored. So if you can keep a person at home and healthy and to avoid either emergency room or nursing home visit, it'll be a savings to the state. And again, the ask is $140,000. And with that, I stand for questions for FY25.
All right, committee, are there any questions in regards to fiscal year 2025? You're lucky Representative Sutton left the room.
Let's keep going fast.
Representative Rogers.
Thank you. So, thank you, Mr. Chairman. Number 2, that's the 140,000. Is this just a pilot program for a targeted area, or
Yeah.
how would that be determined?
Yeah, so this was the appropriation request was originally, it was called the Spark grant funding, which was originally created and awarded in May of 2023, ends on March 1st, 2025. They were at that time asking for $680,000 to fund the current level of care. This is to finish the pilot that's already been established. And again, so at the end, the notation I have is after 16 months of this project, only 2 people have been readmitted to nursing homes out of a cohort of approximately 100 participants, all of whom were nursing home eligible. Significant, since the annual Medicaid cost of Kansas nursing homes would have been well over $100,000. This has the potential to annually save millions of Kansas taxpayer dollars by supporting Medicaid beneficiaries in their homes, staying in their homes longer, and avoiding nursing home placement. So that's the idea, is use this technology to get there.
Very good. Thank you.
Representative Wassinger.
Thank you, Mr. Chair. Excuse me. I'd like to propose a motion, same as, very similar to Representative Williams, that we require KDADS to take immediate action, pardon me, to rectify fraudulent Medicaid payments identified by the Inspector General. This is also the same problem with the other agency, is that the administration is telling these people not to talk to each other to figure out who's causing fraudulent payments. And the Inspector General has found quite a few, and we need to be able to see that list. He's willing to send it to us, but we need to make sure that they're identifying that and they make immediate action, because they're not doing anything when they find out about the fraud.
All right, and that's a formal motion?
Yes.
All right, committee, you've heard the motion. Is there a second? Second by Representative Francis. Discussion on the motion? Seeing none, Representative Wassinger, you may close.
I close.
All right, committee, you've heard the motion. All those in favor say aye. Opposed? All right, motion passes. Any further discussion in regards to 2025? All right, seeing none, Chairman Bueller.
Thank you, Mr. Chair. So flip the page to FY26, kind of the same drill. The total spending across the bottom, agency, LBC, and House. The agency was $3.36 billion, LBC $3.6 billion, and the Budget Committee was $3.74 billion. Again, it's the caseload estimates that are driving up that total cost. I'll spare you the tedium of reading through the agency's request and the LBC's. They concurred with the agency budget request with the following deletions. And 1 through 14 for 2026 from the LBC are all deletions. So if you flip over to page 4, and I would direct your attention again, just as a reminder, item number 15 from the LBC is where they added back $319 million, including 87 SGF, to adopt the fall human services caseload estimates for FY 2026. So that's the starting point for the House Committee on Social Services budget. We did concur with the LBC's recommendation for FY 2026 with the following adjustments. And if I may, so item number 1, add $75 million, including the $29.3 million SGF for 1 year to continue the add-on payment to nursing facilities of $20 a day based on the number of Medicaid residents for FY 2026. And again, I guess before I go any further, the big adds or the big asks for this agency, for this budget for us are items 1 through 4. This one being the top. If you take a look at the handout that was provided to you and just look at the nursing facilities beds closed versus opened from 2018 to 2024, this is the reason this request is in the budget. As we discussed in committee, once a nursing home closes, it will never reopen in this state, and we are in danger, just looking at the closures, of having this vital resource in our state being unavailable. So that is the simple version of why this request is in the budget. Item number 2. Add $35 million, including 13.6 SGF, to add 500 individuals from the wait list to the ID waiver for FY 2026. As you'll remember from last year, the legislature took a pretty strong stand on working on the IDD wait list. I can tell you that the work that we have done, both in terms of adding money to reduce the wait list and capping the wait list, there was a decrease of over 800 people last year through the legislative actions that we took. And this is designed to continue that downward trend. We're currently at around 4,320 people on the IDD wait list, and this budget action is designed to continue to drive the IDD wait list down to 0. Item number 3, if I can move on. Add $6 million SGF for one-time grants to the community mental health centers for FY 2026. This addresses the needs of the uninsured and underinsured. Since the enactment of the Kansas Mental Health Reform Act of 1990, the CMHCSs are required to serve every person who walks through their door, regardless of their ability to pay. So this request actually started out at $8 million in committee. The committee adopting some sense of trying to be frugal with the state's money, reduced the request to $6 million, but this is the request for the certified mental health centers. Number 4, adding $12.4 million, including 4.8 SGF to fully rebase nursing facility reimbursement rates for FY 2026. My note is this is already in the budget. State statute requires a full rebase of nursing facility reimbursement rates based on the prior 3 years of cost reports. Language in the appropriation bill allows the state to opt out of a full funding a full rebase. The consensus caseloads that we talked about earlier, funding includes funding to increase reimbursement rates, but does not fund a full rebase. The addition of $12.4 million, including 4.8 in SGF, would fulfill the statutory requirement based on the prior 3 years of cost reports. And so this just enables us to follow the statute. So that was item number 4. Item number 5, add $2 million SGF to fund the Addictions and Psychiatry and Child and Adolescent Psychiatry Fellowships. This is a program that started, I passed over one, pardon me. Yeah, this started at KU, I think, in 2024. Last year, ongoing funding was added to support addiction medicine fellowships for child and adolescent psychiatric fellowships and behavioral programs at KU Med Wichita, Wichita State University, and the Kansas Board of Behavioral Health Center of Excellence. This was also recommended by, number 5 was recommended by the Subcommittee on Contract Nursing in 2024, including funding this Center of Excellence. So then moving to number 6, add $2 million SGF and delete $2 million SGF from the mental health intervention team programs. There's no loss of service here, no incremental funds. What this is basically saying is there's a provider called Hazel Health that provides essentially telehealth in both physical and mental health programs. They currently serve about 6 million states and 17 states. So this is a new effort that we would undertake and allow Hazel Health to participate in our state's health programs. And again, there's, and to fund it, there was, in this appropriation from a year ago, I think there was 1.8 million unspent. So there's a net SGF of 0 on this particular line item. Number 7, add 1.8 SGF for one-time grants for workforce development for substance use disorders. We had a lot of requests for substance use disorder treatment in hearings and in testimony. This particular organization is called MIR. They received funds in 2025 for a workforce development project to assist in retaining and recruiting staff. They are the largest addiction treatment provider in the state of Kansas that serves Medicaid for the uninsured and underinsured and those involved in the juvenile justice programs. They've got a pretty impressive success rate. 71% of their compliant clients are employed after they go through treatment, 90% maintain employment, and 98% who are outpatient obtain housing programs. And so this is a continuation of the prior year. Number 8, add $4.2 million, including $1.7 million SGF to increase specialized the medical care rate from $50 to $55 for the technology-assisted IDD waivers. I can go through that one, but that's just an increase of that particular code. Over number 9. Add $1.6 million SGF for one-time funding for problematic sexual behavior. This is for kids and cognitive behavioral treatment therapy programs. This is the Children's Advocacy Centers of Kansas. They were awarded some funding in 2024. And the idea here is if you treat children early and often enough that have these particular behaviors, you keep them out of the courts, you keep them out of jails as adults. So their request is, it is an increase, but it's a program that's already established, and it's $1.6 million. Number 10. Add $1 million add $3.9 million, including 1.5 SGF to fund a one-year pilot program for behavioral health add-on payment of $175 per Medicaid day for nursing facilities capped at there's a cap here of 125 people. So this is for people that have a medically based diagnostic disorder that are hard to treat in nursing homes, and nursing homes don't want to take them. So what this program does is it works with nursing homes to provide them with treatment and care options to deal with these patients. The process began in Arizona, I think 20 years ago. This also was a recommendation that came from the interim committee chaired by Les Mason. So the committee is adding this as item number 10. Number 11, add $1 million SGF for one-time funding to offset a federal cut to a senior nutrition funding for 2026. I'm ahead of myself, pardon me. Okay. Oh, here it is. Okay, so if we looked, the committee looked at this one, and to some part, I can maybe anticipate some of the vice's questions on this one. This is where the history of senior nutrition in the state, there were COVID dollars that were added back in the 2020 timeframe. The combined COVID and federal dollars are going away, so this is a $1 million add for funding to offset the federal cut for senior nutrition in FY 2026. Number 12, add $2.5 million, including $983,000 to implement the community support waiver for a partial year with 500 participants for FY 26. This is, again, this is an enhancement request from KDADS. Governor Kelly also recommended this one, but this is additional work to drive down those people who are on the IDD wait list. And it works in tandem with the other funding that we had talked about earlier. Number 13, add $830,000 for one-time funding to renovate a homeless shelter. This is in Liberal, Kansas. It is the Stepping Stone Shelter. It's one of two shelters in the western part of our state. They served in 2024 almost 33,000 meals for residents and walk-ins for a soup kitchen. They had almost 6,000 people who had overnight stays in their facilities. The residents originated from 20 Kansas counties in 2023 and 24. They're not asking for ongoing funding. They're asking for a new kitchen. They have the kitchen probably less than what many of us would have in our homes, but they came in and talked about if you're going to serve 33,000 people a year, they need a kitchen large enough to handle that. And so that's going to handle the renovations in their shelter. Number 14, this is a deletion. So at some point, this is already funded, so I don't know if I need to make a motion or have a motion to delete item 14, but we have found, since this went through our budget, number 14 is already funded, and therefore we can delete it.
We'll do that after you complete all the items.
Number 15 is to add $540,000 SGF for a one-time grant program to provide in-home services for low-income older individuals. This is, again, what we talked about in 2025. This is the Nursing Homes Without Walls pilot program. Number 16, add $350,000 for SGF for a second-year grant to expand core communities. I know some of the committee members are familiar with Youth Core Ministries. They have a program entitled Core Community that offers weekly meetings to provide planning support and networking opportunities. They were added in the DCF budget in 2024. They're based in Greensburg, Kansas, and they exist to give people life direction and help get them educated and essentially stay out of jail. So that's number 17. And then I would say that items 18, 19, 20, and 21 are all language. So there's no ask with these. There is I'll just go through them. So there's add language to rebase rates for the PACE program at 90% of the amount otherwise would have paid for FY26. There's add language to increase the lottery vending machine transfer cap to $12 million. This will actually provide $1 million a month instead of whatever the cap currently is set at, but it's simply a language change. Number 20 is to add language to cap the wait list for the IDD waiver at 4,000 individuals and to cap the PD waiver at 1,800. Again, if this is those steps we're taking to drive the IDD and PD wait list down to 0 that work in tandem. 21, add language to provide 2.4% of funds appropriated for new IDD waiver slots to the Community Developmental Disability Organization, or CDDOs, for their administrative costs. That is part of the process. This amounts to about $840,000. They're the gatekeepers, if you will, of the IDD program. And do I have a 22, Dayton? Can I see yours? So is it 22? Is that the language? That's item 20. Okay, so we're done. Okay, and with that, Mr. Chair, I stand for questions.
All right, thank you, Chairman Bueller. So did you want to make your motion in regards to item number 14 now?
Yeah. Thank you, Mr. Chair. I move that we strike or remove item 14. That item is already being funded.
All right, committee, you've heard the motion, seconded by Representative Ballard. Discussion on the motion. Seeing none, Chairman Bueller, you may close.
I close.
All right, committee, you've heard the motion. All those in favor of the motion say aye. Opposed? All right, motion passes. And then, Jill, I need to make the motion in regards to KDADS with the KDHE to have that funded, because that's the corrective measure. If you remember back from the KDHE health budget, that was actually, it's a KDADS item. So we'd have that included and moved from KDHE health to KDADS. So that's my motion. Is there a second? Seconded by Representative Ballard. Discussion on the motion. All right, seeing none, I close on my motion. All those in favor say aye. Aye. Opposed? All right, motion passes. Right now, we're going to pause and get up to the floor so we can actually be there for the prayer and flag salute sometime this week. So we'll resume discussion so you can digest everything that has been requested by the Budget Committee. And then again, right after we adjourn on the floor, we are going to immediately come back down here and then wrap up this budget and the other, what, 7 or, yes, 6 budgets that we have remaining. Again, we are having lunch provided today by John Pinniger, Doug Smith, J.R. Bayon with ITC, and Michael White with the Kansas Contractors. So lunch will be provided once we adjourn. Immediately come back down here so we can get everything wrapped up. And then whatever we do not get wrapped up by 1:30, we will come back and address that. So until we adjourn on the floor, we are in recess. And get started. And I want to thank the chairman of the Commerce Committee for being gracious to extend the time. I know he's not in the room right now, but allowing us to get through these budgets that we do have remaining. Due to the fact that we would like to get these budgets out, I mean, there's modifications that I was actually going to have motions on in regards to KDADS. I'm going to hold off onto those until next week because I know some members either have Commerce Committee or other obligations that they need to leave. So the plan is going to get through the budgets until our allotted time frame due to the chairman changing that until 2. We will have 3 full days in committee next week to make any changes or motions or anything like that, unless it's imminent, so we can get through these budgets. I'm going to hold off on my motions until next week when we're actually working the budget. So I didn't know if anybody had a question about that. If not, I'll turn it back over to Chairman Bueller.
Thank you, Mr. Chair. I think we're at the point in FY26 we're standing for questions. So if there are no questions.
Representative Walsinger.
Thank you, Mr. Chair. Okay. Trying to remember exactly what the first one was. One question I had was on number 9, I believe. No, it was for, I'm sorry, I've written all this stuff and I don't know where it is now, so I'll.
Representative Powell.
Thank you, Mr. Chairman. Just to clarify, so if we have questions, would you prefer we hold off on those until next week as well? Or
No, I would say questions are pertinent. Motions could be done when we're working the budget because we're reporting out right now, so the questions are relevant. Representative Powell.
Thank you, Mr. Chair. I had a question on number 6 on page 4. It talks about mental health intervention team, deleting that monies and then transitioning to a telehealth service for students. And could you tell us a little bit more about that again?
Yeah, thank
Chairman Bueller.
Thank you for the question. Thank you, Mr. Chair. Yeah, so this is not taking or eliminating the mental health intervention team. So it's taking $2 million, excuse me, from the fund of money that was going to the mental health intervention teams. In 2024, for example, it was $12.6 million, of which they had a $1.8 million unspent funding. So Nationwide is a team that we're looking at for 1 year's funding to see if their telehealth services will augment and actually help what the MHIT teams are doing. So it's a 1-year effort. There's a net zero impact to SGF.
Representative Powell.
Thank you for that. And with that shifting of dollars, excuse me, go to a specific vendor or company, or is there like an RFP put out for that specific service?
Chairman Bueller.
Thank you, Mr. Chair. Not an RFP. The agency that approached us is the name of Hazel Health. They are the nation's largest provider of telehealth in the pre-K to 12th grade population. Most of my committee met with them individually, and they came and testified at the committee. And what they do is they have a pretty robust physical and mental health process that they use in a number of states throughout the country. And it's to augment those services that are out there. And again, it's a 1-year effort. We're not obligated to do anything beyond that, but it's an effort to see if we can't improve the services through this organization.
Representative Walsinger.
Thank you, Mr. Chair. So is all the money going to Hazel Health, or are other people going to be able to do it? My concern is that they will do the public schools, but they won't take care of the mental health of other places. So I'd like to, other private schools.
Chairman Bueller.
Thank you, Mr. Chair. They do work with parochial and public education, so they don't distinguish between the two. And as you know, the MHIT teams work in both public and private schools. The question regarding, is there another vendor? There wasn't another vendor that approached us to do this. So it was just this one organization.
Representative Walsinger.
Thank you, Mr. Chair. What are they doing now, if I may ask? I mean, not Hazel Health. What would we done prior to this with that money?
Chairman Bueller, but that'd be the mental health pilot.
Yeah, so I know last year we took, as a member of the Health Committee, I can tell you, what was a proviso last year, we codified in statute and created the mental health intervention teams. So that has been going on through the mental health system in the state. So that will not disappear, will not go away. We actually made the MHIT teams more robust in statute last year. This is just taking 1.8, roughly, of the $2 million, 1.8 of it is unspent in that fund. And so it's just a way, again, to see if we can augment the mental health and to some degree physical health services that it's provided through telehealth.
Representative Walsinger.
Thank you, Mr. Chair.
Any further discussion in regards to 2026? Representative Turk.
Thank you, Mr. Chair. On the same subject, what kind of vetting was performed with this company? I believe it's an out-of-state company, correct? For-profit out-of-state? Is that how I read their website? Was there any vetting procedures done for this?
Chairman Bueller.
I didn't vet them. No one on the committee vetted, and that's not typically the way all of the requests that come to us happen. There are agencies that come to us as I mentioned, we had, in committee, we had well over 40. They all come the same way. So this organization came the same way. We don't vet the other 45 that come, nor do we vet the other 45 that provided written testimony, other than the relationships that we may have already established with them.
Representative Turk.
Thank you, Mr. Chair. Well, just to be clear, I apologize. I didn't mean did you vet them or your committee vet them. Certainly, I don't expect you guys to be the vetting authority, but my question was if, before it came to you, if anybody within this budget had done any vetting for them. So I didn't mean it to come across that I expected you to.
No, thank you for the question. No one at KDADS approached me and said that they had vetted this group.
Representative Ballard.
Thank you. I will just say 4 of those members came by the office. One was a former legislator here who no longer lives in Kansas, and she was a legislator, I think, here for like 7 or 8 years, something like that. And they came and they just explained their program, what they did, how they could enhance what we have. So they went around to various places, but I can only say in terms of they came the day before we actually met them. So I learned a lot about that, and they left handouts with us and everything else. So that's how I learned about them.
Representative Mosier.
Thank you, Mr. Chair. So just to clarify, this is a for-profit company, and we're going to give them $2 million to do this telehealth.
Chairman Bueller.
That's correct.
Thank you.
Representative Rogers.
Thank you, Mr. Chairman. I know the time is near. Number 17, is that new money? Is that something new? And how far will $250,000 go? Thank you.
Chairman Bueller.
Thank you, Mr. Chair. Thanks for the question. It is a continuation. This is a second-year grant to expand core communities for FY26. I believe the first year that this was funded was in 2024 when the legislature added $350,000 SGF. And I think, as I mentioned before, this is based in Greensburg, Kansas.
And
I'm sorry.
any further questions in regards to 2026? Representative Walsinger.
Thank you, Mr. Chair. So let me see if I've got this right. We're giving $2 million to a for-profit company from out of state, but we've had the program working all along. So are they getting an additional $2 million, and you're keeping the other program that
Sure.
has worked with locals?
Chairman Bueller.
Thank you for the question. No, it's an augment. It's an augment to the services that can work in parallel with the mental health intervention teams. It's not a duplicative effort. It is, if you think of the realms of telehealth and medicine, they can do screenings, they work with parents. Parents have to want to work with this with their children. There's nothing forced about any of this. So it's a service that's available. Their estimation is they can provide telehealth services to over 183,000 Kansas. To me, that's intriguing. So again, there's no taking money away from or a reduction of service in the mental health intervention teams. Hard to say fast. As I mentioned, there's $1.8 million in unspent funds. This appeared to be an opportunity to see if we can expand health care, whether it's mental and or physical health. That's the reason why it was intriguing.
All right.
And they are in, I think, 17 other states.
Thank you, Mr. Chair.
Any further discussion or questions in regards to 2026? All right, seeing none, Chairman Bueller.
Can I check with the revisor? I'm not sure if we have any amendments.
We did. We had two.
Okay, then I will close appropriately then. Thank you, Mr. Chair. I move the Social Services Budget Committee recommendations for the Kansas Department for Aging and Disability Services for budget for fiscal years 2025 and 2026 as amended.
All right, committee, you heard the motion, seconded by Representative Ballard. All those in favor of the motion say aye. Aye. Opposed? All right, motion passes. All right, thank you, Chairman Bueller. We'll go ahead and move on to Chair Howe with the Higher Education Budget Committee, and I believe you're going to be starting with Fort Hays State University. Chair Howe.
Thank you, Mr. Chairman. So just to preface some of what you're going to be seeing over the next two budgets, you'll see Fort Hays State University, then Pittsburgh State University. Both budgets, we've adopted the Legislative Budget Committee's recommendations on those. But we did add a notation to both of those Budget Committee reports. But starting off with Fort Hays State University, they do want to thank the legislature for the investment made in last year's budget bill of $3 million SGF. They've been able to invest that in a targeted way to drive student success. So fiscal year 2025, Mr. Chairman, in terms of time, would you rather I skip over the agency narrative and just go right into?
Yeah, just go into the financial details.
Okay. So the Special Committee on Legislative Budget concurred with the agency's revised estimate in fiscal year 25 with the following adjustment: to delete 6 FTE positions within the Public Service Program for fiscal year 26, and the Budget Committee concurred with the LBC's recommendation.
Committee, any questions in regards to fiscal year 2025? All right, seeing none, Chairman Howell.
So moving on to fiscal year 2026, again, the LBC concurred with the agency's revised estimate for fiscal year 26 with the following adjustment, again, to delete the 6 FTE positions within the Public Service Program. The Budget Committee concurred with the LBC's recommendation for fiscal year 26 with the following adjustment. And this is the notation that we added, and we had a lot of discussion around this a couple days ago in committee. The House Higher Education Budget Committee would like the Committee on Appropriations to consider information requested to be provided by the State Board of Regents pertaining to the history of base state aid funding at the regional universities, specifically Fort Hays State University. So what does that mean? That means is, and many of you may have heard from some of the regional universities, it's been brought to our attention that there is a inequity between the 3 regional universities and the 3 research institutions within the Regent system. We've been given some data. However, we haven't had the opportunity to have the Board of Regents come before the committee, so they are scheduled to come to our committee on Tuesday. But we've been given information that the regional state universities are, if you take it from a local revenue per FTE student, there's around an $8,000, a little bit more than $8,000, or not, yeah, $8,000 difference between the state revenue per FTE at a research institution as opposed to a regional state university. So as I understand it, the state changed the way that the institutional aid and the cost model back in either the late 90s or the early 2000s. And apparently there's been brought to our attention some sort of inequity on that. So we will have a hearing on that on Tuesday to get some more information. We really want to study that. So that's what the notation is, Mr. Chairman. I'll stand for any questions.
All right, committee, are there any questions for Chair Howell? Seeing none, Chairman Howell.
Thank you, Mr. Chairman. I move the House Committee on Appropriations adopt the Budget Committee report for Fort Hays State University for fiscal year 25 and fiscal year 26.
All right, committee, you've heard the motion, seconded by Representative Amix. All those in favor of the motion say aye. Opposed? Motion passes. All right, Chairman Howell.
Thank you, Mr. Chairman. Again, Pittsburgh State University received the $3 million regional investment as well last session in the budget bill, and they were able to reinvest that into student success. They created a scholarship program that's affecting 700 students currently there at Pittsburgh State University, and they're trying to bring that value back to the students and to help with recruitment and retention. So for fiscal year 25, this is very similar to Fort Hays State University. We've made no changes. So the Special Committee on Legislative Budget concurred with the agency's revised estimate in 25 with the following adjustments: to delete the 12.7 FTE positions for academic advisors and research scientists for 25, and the Budget Committee concurred with the LBC's recommendation. Mr. Chair, I'll stand for questions.
All right, committee, any questions in regards to 2025? All right, seeing none, Chairman Howell.
Thank you, Mr. Chairman. For fiscal year 2026, again, there's a standard language about the deletion from the Special Committee on Legislative Budget, and then there's the notation about the need for us to get more information from the Board of Regents about the base state aid funding for the regional universities, and emphasizing Fort Hays State University as being perhaps a little bit more disproportionate than even Pittsburgh State and Emporia State. We were given a chart, and I'm sorry, I probably should have printed one off for each of you, but maybe the regionals can send it to you. This was from Pittsburgh State, and it shows the discrepancy between the research institutions all the way down to the regionals here. And so that's something we're going to explore and learn more about and see what we can do, because certainly the last thing we want to do is provide an unlevel playing field amongst our regent institutions. And so that's our mission in a short time period. I'm not sure we'll be able to correct that or remedy it in this budget cycle, but we will see what we can do to address it. Mr. Chair, I'll stand for any questions on fiscal year 26.
All right, committee, are there any questions in regards to 26? Vice Chair Williams.
Thank you, Mr. Chair. And concerning what you're going to do and making sure there's parity between the different universities, I do notice that the actuals from 2023 all the way until 2026 is an increase. And what we have received is that, let's just say from Pittsburgh State University, their overall enrollment is down 63%, and their on-campus enrollment is down 16%. So I guess, are we right-sizing, or is it just the lack of parity, and we're overpaying maybe for everyone?
Chairman Howell.
I'm not sure exactly. You had mentioned 63%. Is that what you said?
Yes, yes. The overall enrollment, the numbers that I have for Pittsburgh say that they're down negative 63%. But on campus, so if you divide it between on campus or if you divide it between online, on campus, they're down 16%. And I really do think that that needs to be part of the discussion when we're appropriating dollars. We are trending down at majority of our universities and our community colleges. And so I hope that you'll take that in consideration when you're having your discussions. Thank you.
Chairman Howe, do you have a response?
I would have to look at your numbers to see, but that seems really, really high. It seems like we'd have much more of an issue with this budget if it was indeed 60-some%. But I'll be glad to work with you, Vice Chair, on that to see what we can do. But I believe Pittsburgh State University has 5,774 students. And, you know, they're unique in many ways, not only being a regional university, but they do some research as well. They're situated in a geographic part of the state where, you know, Missouri and Arkansas and Oklahoma are not too far away. So in some ways, that's an advantage because you have some additional metropolitan areas to try to recruit from, but the competition is very fierce across the border. And so they're doing what they can to put a good effort in. So I don't have anything else to comment at this time.
Representative Amix.
Thank you, Mr. Chairman. And just to kind of dovetail on what my chairman had brought up, we did have quite a bit of discussion after this bar graph came up to see just the differences, the way that it was presented in the SGF for full-time, you know, equivalent students on campus. So we'll take the comments of the vice chair, obviously, into consideration and do a thorough look at this. So anyway, thank you.
Any further discussion in regards to 2026? All right, seeing none, Chairman Howe.
Thank you, Mr. Chairman. I'll close on behalf of, I believe, the only institution in the nation that has a gorilla for a mascot. I move the House Committee on Appropriations adopt the Budget Committee report for Pittsburgh State University for fiscal years 25 and 26.
All right, committee have heard the motion, seconded by Representative Amix. All those in favor of the motion say aye. Opposed? All right, motion passes. Thank you, Chairman Howe. We'll go ahead and turn it over to Chairman Anderson with the Transportation and Public Safety Budget Committee, and he's going to be starting with El Dorado Correctional Facility. Chairman Anderson.
Thank you, Mr. Chairman. Starting with El Dorado, FY 2025, the agency submits a revised estimate of $48.4 million, including $48.2 million SGF and 492 FTE positions in 25. This estimate is $1.7 million above the amount approved by the 24 legislature. The LBC concurs with the agency's revised estimate. With one adjustment, they deleted $382,000 reappropriation. The Joint Committee concurred with LBC, and the House Budget Committee concurred with the LBC's recommendation. I'll stand for questions on 25.
All right, committee, any questions in regards to 2025? Seeing none, Chairman Anderson, 2026.
Thank you, Chairman. Moving on to 26, the agency requests $48.5 million, including $48.5 million SGF and 492 FTE positions for 26. The request is $2.3 million above the FY 25 amount. The LBC concurs with the agency's request for FY 26 while deleting $248,000 SGF for premium pay. The Joint Committee on State Building concurred with the LBC's recommendation, and the House Budget Committee concurred with the LBC's recommendation, but added back in the $248,000 for premium pay. And with that, I'll stand for questions on 26.
Committee, any questions for the chairman? Representative Sutton.
Thank you, Mr. Chair. $248,000, and that's just for premium pay. How many employees is that divvied up amongst?
Chairman Anderson.
If it was discussed, I don't know.
Thank you, Chairman. We're working on getting that from the agency. We'll have that next week.
All right, thank you.
Any further questions in regard to fiscal year 2026? All right, seeing none, Chairman Anderson.
Thank you, Mr. Chairman. I move the recommendations for El Dorado Correctional Facilities for fiscal years 25 and 26.
All right, committee, you've heard the motion. Is there a second? Second by Representative Hoheisel. All those in favor of the motion say aye.
Aye.
Those opposed? All right, motion passes. Chairman Anderson.
Thank you, Chairman. Moving on to the Kansas Juvenile Correctional Complex. Starting with FY25, the agency submits a revised estimate of $29.5 million, including $28.8 million SGF and 248.5 positions for FY25. The revised estimate is $2.6 million above the amount approved by the 24 legislature. The LBC concurs with the agency's revised estimate for 25, while deleting $2,023 SGF for reappropriation. The Joint Committee on State Building concurs with the LBC's recommendation, and the House Budget Committee concurred with the LBC's recommendation. Stand for questions on 25.
All right, committee, are there any questions in regards to fiscal year 2025? Seeing none, Chairman Anderson.
Thank you, Mr. Chairman. Moving on to FY26, the agency requests $29.5 million, including $29 million SGF and 248.5 FTE positions. The request is $3 million above the FY25 approved amount. The LBC concurs with the agency's request. The Joint Committee concurs with the LBC's recommendation, and the Budget Committee concurs with the LBC's recommendation. I will stand for questions on 26.
All right, committee, are there any questions in regard to fiscal year 2026? Seeing none, Chairman Anderson.
Thank you, Mr. Chairman. I move the recommendations for the Juvenile Correctional Complex for fiscal years 25 and 26.
All right, committee, you've heard the motion, second by Representative Hoy. All those in favor of the motion say aye. Aye. Those opposed? All right, motion passes. Chairman Anderson.
All right, thank you, Mr. Chairman. Moving on to the Kansas Highway Patrol, starting with fiscal year 2025. The agency requests a revised estimate of $133 million, all federal and special revenue funds and expenditures in FY25. The revised request is an all funds increase of $4.2 million above the amount approved by the 24 legislature. The LBC concurs with the agency's revised estimate in 25 with the following adjustments. They deleted $2.6 million for the body-worn cameras, deleted $1.1 million all special revenue funds for the one-time safety repairs facility at Salina Training Academy, and deleted $318,000 all special revenue funds for salaries and wages increase in the administration and motorist assistant programs. The House Committee on Transportation concurs with the LBC's recommendation in 25 with the following adjustments. We added back in the $1.5 million for the body-worn cameras, $1.1 million for the facility in Salina, and the $318,000 all special revenue funds for the salaries and wages. And the Joint Committee on State Building Construction concurred with the LBC's recommendation. With that, I'll stand for questions on 25.
All right, thank you, Chairman Anderson. So in regards to item number 1 on your committee and item number 2 on the governor's recommendation, she has 1.4, you have 1.5. Is that just a rounding difference? Same amount, just it was rounded differently? That's correct, okay. And then you have $318,000 for salaries and wages, and she has $514,000. Is that the same? Because you have for administration and motorist assist programs, but she doesn't have it listed. She just has salaries and wages for 25.
I'm being told that that's just how it's reported. It's the same. Okay, so from the original request, the $318,000 was removed, and we've just added that back.
But I'm asking why the governor has $514,000 in her request, recommendation. Is that the same or is that different? Not what the LBC did, what the governor has recommended.
It sounds like that's just how, with the new process, that's how it's being shown here, but I can get you a better answer for next week.
Okay, thank you. Committee, any questions in regards to fiscal year 2025? Chairman Anderson?
Chairman, yeah, we went with the governor, so it would be the same, just to try to correct that.
Okay, I think we have more discussion on that because the dollar amounts are not the same. Anyways, Representative Sutton.
Thank you, Mr. Chair. I'm trying to make heads or tails of this myself. And what I'm thinking, and maybe this is off base or maybe it's not, I don't know. The 318,000 that the Legislative Budget Committee cut out and then got added back in by the committee, that is for salaries and wages, but it looks like it's for administration and motorist assistance programs specifically, whereas in the governor's recommendation, it's just salaries and wages in general. Maybe there's another program or something that she was wanting to fund, or another area that she wanted to fund wages, a wage increase for, that isn't in evidence on our sheet of paper here. That's my guess. I'm just making this up.
And research did clarify that there are two different things from the governors to what the Budget Committee had recommended.
Gotcha.
Any further discussion on 2025? All right, seeing none, Chairman Anderson.
Thank you, Mr. Chairman. Moving on to FY26. The agency requests $192.9 million, all federal and special revenue funds and expenditures for 26. The request is an all funds increase of $64.1 million above the 25 approved amount. The LBC concurs with the agency's revised estimate for 26 with the following adjustments. They deleted $48.3 million for the one-time construction of the new Kansas Highway Patrol headquarters facility, deleted $7.3 million for the one-time construction of the hangar at Jabara Airport, deleted $4 million, one-time purchase of a new Cessna 206 for the Kansas Highway Patrol Air Support Unit, and deleted $1.4 million for the one-time purchase of a new IT infrastructure components for 2026. The Budget Committee concurs with the LBC's recommendations for 26 with two adjustments. We added back in the $800,000 all special revenue funds for the one-time purchase of new IT infrastructure, and we added language that the Kansas Highway Patrol provides a presentation to the Budget Committee concerning the findings of the Kansas Highway Patrol Salina campus needs assessment to our committee, and the Joint Committee on State Building added the same language.
All right, committee, are there any questions in regards to fiscal year 2026? Representative Francis.
I hate to slow things up, but, you know, in regards to the thing earlier about the 514 and the 318, just for point of information, it looks like on page 3, LBC only cut 318, so they only needed to add 318 back in to make it whole, if that makes sense. I just thought I'd clear it up now.
Any other further discussion on 2026? All right, seeing none, Chairman Anderson.
Thank you, Mr. Chairman. I move the recommendations for the Highway Patrol for fiscal years 25 and 26.
All right, committee, you've heard the motion, second by Representative Hoy. All those in favor of the motion say aye. Aye. Opposed? All right, motion passes. Now on to the final budget, the Kansas Department of Transportation. Chairman Anderson.
Thank you, Mr. Chairman. Moving on to KDOT, starting with FY 2025, the agency estimates expenditures of $2.6 billion, all federal and special revenue funds, and expenditures in 25. The revised request is an all funds increase of $233.3 million above the amount approved in 24. The LBC concurs with the agency's revised estimate in 25 with the following adjustments. The LBC deleted $4.1 million all state highway fund for salaries and wages and 45 FTE positions for regular maintenance, and deleted $1.7 million for salaries and wages and 26 FTE positions in the construction inspection program. The House Budget Committee concurs with the LBC's recommendation in 25 with the following adjustments. We're adding back $4.1 million for salaries and wages in regular maintenance program, added $1.7 million for salaries and wages in the construction inspection program, added 2 FTE positions for the local projects program, add 1.5 FTE positions for the Office of the Secretary, add 9.5 FTE positions for the Operations Support Program, and add 1 FTE positions for all other adjustments. And the Joint Committee on State Building Construction concurs with the LBC's recommendation. And Mr. Chairman, I'll just make a note on 3 through 6 here, we're not actually adding any FTEs. Once again, it's just how the system put it in this year. I'll stand for questions.
All right, well, thank you for pointing that out because it does look like you're adding a lot of positions. I had a question that was posed to me a couple of days ago by an individual, and he was wondering if all the employees at the Kansas Department of Transportation, or if there's any that are still working from home, or are they all back in offices, out on the field?
Yeah, thank you, Mr. Chairman. I'll get back with you on an answer on that. I don't believe so, but we'll check.
All right, thank you. Committee, any questions for fiscal year 2025? All right, seeing none, you may move on to 2026.
Thank you, Mr. Chairman. Starting with FY 2026, the agency requests $1.7 billion all federal and special revenue funds and expenditures for FY 26. The request an all funds decrease of $647.8 million. The LBC concurs with the agency's revised estimate for FY 26 with the following adjustments. They deleted $3.9 million for salaries and wages and 53 FTE positions in regular maintenance. Deleted $1.7 million for salaries and wages, 27 FTE positions in the construction inspection program. Delete $1.3 million for salaries and wages and 8.8 FTE positions in the administration program. Delete $1 million for salaries and wages and 9 FTE positions in the design right-of-way program. Delete $22,000 for salaries and wages and 1.5 positions in the Office of the Secretary. The Budget Committee concurs with the LBC's recommendation for 26 with a few adjustments. We added back the $3.9 million for salaries and wages and 45 FTE positions for regular maintenance, $1.7 million for salaries and wages and 26 FTE positions in the construction inspection program, $1.3 million for salaries and wages and 0.2 FTE positions in the administration program, add $1 million and 1 FTE position in the design right-of-way, add $22,020 and delete 1.5 FTE positions in the Office of the Secretary, and then deleted 9.5 FTE positions in the Operations Support Program and 5 FTE positions in all other adjustments. The Joint Committee on State Building concurs with the LBC's recommendation, and Mr. Chairman, I'll stand for questions on 26.
All right, thank you, Chairman Anderson. So it looks like if you go to the governor's recommendation for fiscal year 26, I think you adopted all of the items that the governor had recommended in her budget. Is that correct?
That's correct. I have a motion for next week to remove part of it after speaking with the agency, but we'll wait on that.
Okay. Any discussion in regards to fiscal year 2026? All right, seeing none, Chairman Anderson.
Thank you, Mr. Chairman. I move the recommendations for Department of Transportation for fiscal years 25 and 26.
All right. Committee, you've heard the motion, seconded by Representative Hoheisel. All those in favor of the motion, say aye. Opposed? All right. Motion passes. Representative Sutton.
Thank you, Mr. Chair. I have a question for the second.
Well, thank you, Representative Sutton. Okay, well, that actually concludes all of our work in regards to the budget report outs. Again, I believe the chairman of Commerce and Economic Development was out when I thanked you for giving us the grace of an extra 30 minutes and starting your committee late, but I just appreciate your willingness to do that. And Chairman Tardwater.
Yeah, so you're welcome, but you probably ought to thank the Chancellor Gerard, because he's going to miss his flight to the Super Bowl now. Thank you.
Oh. I'll say.
No, we do not. We got rid of our plane.
I will I'll confirm that with the Chancellor. So again, well, thank you again for bumping it back a half hour. But I want to say again, no Monday, we're not having a meeting on Monday morning. So we are not having, there's no meeting scheduled. Tuesday will be coming in, as I mentioned before, in regards to, kind of expediting the process this afternoon. If you have any of the motions from the budgets that we had this afternoon, bring those forward, and we have 3 days to work on the budget. As I mentioned before, it's been asked by staff that we pass the budget out on Thursday. That way it gives them the weekend to work on it instead of having to work overnight. I've explained that before. Again, I would like to thank John Pinniger, Doug Smith, J.R. Barron, and Michael White for lunch so we could continue working. So thank you. And so, committee, until Tuesday morning at 9 a.m., we are adjourned.